Okay. You start. Welcome everyone to the PPLER meeting. I guess we'll start with the call to order. Is there a resolution for that? No, call to order at 5:01. Let's call it. We'll go to the land acknowledgement, and Karen Cook will be required now.
The health unit is situated on the lands that are the traditional territory of the Anishinaabe people who continue to live, work, and play throughout these territories, including urban communities. I encourage everyone to think about how they may contribute both personally and professionally to the process of reconciliation and respond to the 94 calls to action of the Truth and Reconciliation Commission of Canada.
Thank you, Karen. Item 3.0, which is the approval of the agenda. Be it resolved that the Personnel, Policy, Labor, and Employee Relations Committee agenda dated November 26, 2025 be approved. Do I have a motion, Rick and Pat? Seconder? Jamie McGarvey, okay. If there's Jamie's in there. We'll call it out. Rick?
Yes.
Yes.
Blair?
Yes.
Sharon's away, absent. I agree. Jamie McGarvey?
Yes. Yes.
No,
He's on mute.
Okay.
doesn't look like you're on mute, Jamie, but we can't hear you.
Oh,
Thumbs up.
Yep.
Okay.
Jamie Rastool?
yes.
Oh, he's also.
Oh, is our room audio off?
I could barely hear Jamie before, but I can
There
hear
we
you
go.
guys okay.
It was at our end. We're all good now. Thank you.
Okay.
Can you hear me
Thank
now?
you.
Yes, thank you.
Okay, good.
Hey, Tim?
Yes.
Classic, Marianne? I think she's here yet. Okay. And Dave Wolf is mark him absent for now. That is carried. All right. Any conflict of interest to be declared? Seeing none, you still have an opportunity. If there's something that comes up and you feel there's a conflict, just let me know. 5.0 approval of the previous minutes. Let me just read the resolution. Be it resolved that the minutes from the Personnel, Policy, Labor, and Employee Relations Committee meeting held April 23rd be approved as presented. Do I have a mover? Karen Cook. Thank you. Seconder, Jamie Rastool. Perfect. Thank you. Call it out. Ray Champagne.
Eat.
Karen Cook.
Yes.
Blair Flowers.
Yes.
There's absence. I agree. Jamie McGarvey.
Yes.
Jamie Rastool.
Yes.
Tim.
Yes.
Marianne and Dave Wolf. That is carried. Thank you so much. This is just flying by today. Item 6.
There,
We're going to the 5.2. Okay, 5.2 of the Personnel Policy, Labor Relations, Employee Relations Committee in camera minutes dated April 2023. Do I have a resolution for that? Let it be resolved that the in-camera minutes from the Personnel Policy, Labor, Employee Relations Committee meeting held on April 23rd, 2025 be approved as presented. Do I have a mover? Tim? Thank you. Seconder? Karen? Thank you. Call it out. Rick?
Yes.
Yes.
Blair?
Yes.
There's absent. I agree. Jamie McGarvey?
Yes.
Thank you. Jamie Rastool?
Yes.
Tim?
Yes.
And Marianne and Dave are absent. That's carried. Perfect. The date of the next meeting is to be determined, time to be determined, and the place to be determined. Business arising. You have any business arising? No business arising? and in camera. Okay, I'll read the resolution. Okay, so where is the Board of Health? Is there another one in here for me to go into camera?
The next one.
Oh, next.
That one needs to be read.
Gotta read that one. though.
Where the Board of Health Recorder Secretary is, yes. Actually, will be excused for the duration of item 8.3 during the in-camera session. Be it resolved that Paul be appointed as Secretary Pro Tem for the purpose of recording the confidential minutes of the in-camera session during 8.3. Do I have a move? Okay. Seconder? Okay, thank you. Call it out. Rick?
Yes.
Yes.
What?
Yes.
You. There's absence. I agree. Jamie McGarvey?
Yes.
Thank you. Jimmy Restool?
Yes.
Tim?
Yes.
Marianne? Dave Wolf? That is carried. Okay, next one is to move in camera. Be it resolved that the Personnel Policy Employee Labor Relations Committee move in camera at
5:10.
5:10. Okay. PM to discuss the following. Item 8.3, a personal matter about an identifiable individual, and 8.3, labor relations or employee negotiations. Do I have a move? Blair?
Jamie's up there too.
Oh, is he? Okay, sorry. Sorry, James. Seconder? Blair? Okay, thank you. Call it out. Rick Chambang?
Yes.
Blair?
Yes.
There's absence. I agree. Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Tim Shepard?
Yes.
And Dave Wolf are both absent. That is carried. Okay.
Just waiting for confirmation from my team.
Both unions ratified their respective agreements in November 2025, and whereas negotiations for the management non-union employee policy include monetary adjustments identical to those negotiated with the Ontario Nurse Association, the Ontario Public Services Employees Union, be resolved that the Personnel Policy, Labor and Employee Relations Committee recommend to the Board of Health approve the changes to the collective agreements between the North Bay Parry Sound District Health Unit and Ontario Nurses Association and Ontario Public Services Employees Union, and approve the revised management non-union employment policy for full-time, part-time employees effective April 1st, 2025 to March 31st, 2027. And do I have a mover? Cook. Seconder? Jamie? McGarvey. I'll call it out. Ray Champagne.
Yes.
Cook.
Yes.
Blair Flowers.
Yes.
Which is absent. I'm okay. Jamie McGarvey.
Yes.
Jamie Rastool.
Yes.
Tim Shepard.
Yes.
Thank you. Marianne.
Yes.
Thank you. Dave Wolf.
Yeah.
That's carried. And any new business? Business adjournment is at
5:39.
5:39. Thank you. Merci. Language. Thank you.
Thank you, everyone, for joining the our meeting tonight. Just a little bit of housekeeping. Everybody's got a little red envelope. And I think online through your portholes, in order to confidential, your code of conduct regulation needs signing. Needs to be done sooner than later for 2026. And for your statements during the years, that you make sure you stay confident or confidential. I was
Always confident.
it was hard to get that one out for some reason. But anyway, could you please make sure they all get signed and done, please? And get them returned to Ashley as soon as possible. I think we all have envelopes tonight. We should have to do it tonight and online. Send them in, please. Thank you. Call the meeting to order. Need a mover and a seconder, please.
Just approval.
Okay, sorry. Approval of the agenda. I'm sorry, Mr. Wolf and Jamie Larry.
Lowry. Stay low for short.
Well, you can't say champagne, so. So to resolve, the Board of Health agenda dated November 26, 2025 be approved. Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Sarah Inch is out. Jamie Larry. Jimmy McGarvey.
Yes.
Jamie Restool.
Yes.
Tim Shepard.
Yes.
Mary Ann Stickland.
Yes.
David Wolf.
Yes.
Carried. Conflict of interest. Again, if something comes up, so you hear something or bring it up to our attention and we'll note it. Next one is 4.0. We have some people coming in to present. Okay. We have Mr. Chris Bose, Louise Gagné, Sharon Manta, Julie Patenaude Bouffard, Aaron Reese, Terry Smith, and Kylie Wardell. And they're coming as we speak. Take a moment. Ladies, gentlemen,
Ladies and gentlemen.
Kylie is online. Perfect. The first one presenting Priority 1, Strategy 2, Foster Leadership Through Improved Performance Management and Success Planning. Julie Patenaude Bouffard and Terry Smith, Manager.
Okay.
Thank you for coming this evening, and the floor is yours.
Just going to share the presentation. You can leave the door open. Well, thank you. I'm really pleased to be here today to share the progress on Priority 1, Strategy 2, Foster Leadership Through Improved Performance Management and Succession Planning, which falls under Priority 1, Organizational Wellbeing. I'm Terry Smith, Manager of Quality, Practice and Relations, and the lead for a strategic initiative. Joining me today from our working group is Julie Patenaude Bouffard, the Manager of Oral Health, who's my co-presenter, along with Shannon Mantha, the Executive Director of Clinical Services and our Chief Nursing Officer. And in addition, our working group includes 6 other members from across various health unit programs who have contributed to this work. This strategy grew out of an earlier manager-led effort to improve performance management. When it became a strategic priority, we were able to build on that foundation and move the work forward. Next slide. Before we dive into progress, I want to frame a few key concepts. Oh, sorry. Could you go to the next one? The next. So the first is competency profiles, which are documents that outline the knowledge, skills, and behaviors needed for success in a role. They guide development, recruitment, performance evaluation, and succession planning. We align them with the Ontario Public Health Standards and core competencies for public health practice. The second is performance management, which is an ongoing process that includes setting clear goals, providing feedback, supporting growth, and recognizing achievements. Strengthening this system helps our staff to succeed and drives continuous improvement. And finally, succession planning, which is one of the strategies that helps us prepare our organization for the future by developing leadership capacity and planning for key role transitions. There are 2 streams, managing risk for critical roles and developing future leaders. Our focus is on the second, developing future leaders. I'll now turn things over to my colleague, Julie, who will walk us through our progress to date.
Thanks, Terry.
Next slide.
So here's where we started. As Terry mentioned, we wanted to build on what had already been done, not start from scratch. We also knew there had been other leadership efforts in the past to improve performance management, so we made sure to include that work as well. From there, we reviewed best practices and evidence related to both performance management and succession planning. We looked at what's working, what's challenging, and where the gaps are in our current process. We also engaged both our management and executive teams for their perspectives. And finally, we pulled it all together into a logic model that helped us define our goals, outcomes, and what resources or factors we need to move forward effectively. As we looked at the research on succession planning, we noticed 2 very different but equally important approaches. The first is risk management,
The second is where our team is focused, leadership development, identifying frontline staff who are both high performing and high potential, and supporting them to take on stretch opportunities and development. We also recommended updating our competency profiles to reflect what's needed today and in the future. And for performance management, we decided to pilot a system first, test it, learn from it, and then roll it out more broadly in years 1 and 2 with an evaluation afterward to make sure it's meeting our goals. Here's where we are in our plan. Our competency profiles are about 82% complete, 53 out of 57 done, so we're almost there. We selected Pulse 360 for our pilot performance management tool with launch in mid-November. We're putting together a manager toolkit, something practical and useful, containing coaching resources, tips for having difficult conversations, and tools to help managers support their staff more effectively. And finally, as part of our succession-focused staff development, we'll be doing a workforce capacity assessment. Next slide, please.
I think we're good, Shelley.
No, we're good?
Yeah.
So now we'll talk about the tool we'll be using. Pulse 360 has 360 feedback surveys, which are web-based and completely anonymous. These surveys gather feedback from peers, staff, and even community partners, so you get a full picture of how someone is doing. It's a validated best practice tool that uses Likert scales, and it's very efficient. Once staff get their feedback results, they'll have access to targeted coaching and education modules. There are over 100 to choose from. They're all online, easy to access, and really practical. The system lets us see trends across our organization so we can get a sense of how our teams are doing overall. Reports are also based on healthcare benchmarks, so we can see how we compare to similar agencies. And with that, I'll turn it over to Terry to share more about our anticipated outcomes.
Thanks, Julie. Next slide. So here's what we're expecting to achieve with our planned initiatives. We're looking to foster growth-focused conversations, and we expect to shift from biannual transactional reviews to a more meaningful trust-building conversation. By using the coaching approach, we'll support staff development through regular, reflective dialogue that encourages progress and engagement. Secondly, supporting continuous learning. We expect to embed learning into everyday work. We are building systems where individuals reflect, share insights, and apply new knowledge in real time. This will help us to stay responsive and continuously improve how we serve our communities. And finally, advancing effective public health practice. It isn't just about improving our internal processes. We expect that by strengthening individual communication and collaboration skills, we'll be better equipped to engage our vulnerable populations, build strong partnerships, and work more effectively to deliver coordinated, impactful public health services. These are the outcomes we're aiming for. Evaluation will be key to understanding our impact and guiding improvements. Next slide. Thank you, and we're happy to take any questions you may have.
Lynn, more of a comment. I absolutely love the conversation with employees, because I'm always shocked when they talk about doing a performance appraisal and people are surprised what their results are. So having that, like, everyone in your organization should know how they're doing it any given day. They should not be. So I really, really think that is absolutely amazing that the organization's, is moving in that direction. There's a lot of the survey work and those kinds of things, but is there any ability or is there any thought of having actually a live coach for like, not when they're on a PIP or anything like that, but someone like, every coach needs a coach. So I know you might be getting it from a supervisor or maybe a contemporary, I'm not sure, but do they have access to some kind of live coaching?
So as supervisors, part of the program is for them to coach us in the way that we work with our staff. So that is part of the program that we have.
So we don't have like a certified executive coach that could, because even the supervisors should have a coach, right?
Yeah, so I can jump in. So through Pulse 360, we can access that. Now it's not part of the what we're currently doing, but there will be an option. So I think in the event that we identify that over time, we've just started rolling this out. So we're all kind of getting used to the process and the tool. I think if we identify that add-on piece of coaching is helpful, we will use it. Historically, we have purchased coaching for times when it's needed, where we felt like our internal skill set didn't match the need. So we've done that in the past, but
Yes, we've done that in the past on an individual level, but also at the management, like offering coaching sessions to the management as a whole. Was it June 2024? We had all of management coach, like trained in a coaching approach.
Right.
So it's kind of part of the ongoing investment as well in management.
Because there's lots of evidence to show that kind of environment, that kind of culture actually increases productivity immensely. I think it's changed, totally shifts the focus, because we tend to do more crisis intervention with PIPs and all that, and by then it's almost too late. But by having this, embracing the coaching culture it's outstanding. So congratulations.
Brings enjoyment to the workplace.
Not at the board level, but certainly in the work.
We need coaching. Well, thank you very much. Any other questions online? No, we're good. Thank you very much. We'll go to item number 2, priority 2, strategy 4, cultivating our role within the system level for efforts to reduce poverty and homelessness. Mr. Chris Bowes and Aaron Reese.
Great, thanks, Rick. So I'm Chris Bowes. I'm the Executive Director of Organizational Effectiveness. I think last time I was at the board was probably the last strat plan update we did in Parry Sound, so it's great to be back. And then Aaron Reese, the Health Promotion Specialist, is my co-lead on Priority 2 Strategy 4. So as Rick said, our focus is cultivating our role within system-level efforts to reduce poverty and homelessness. And we have a working group of 8 different members from different programs across the organization. It includes people from organizational effectiveness, clinical services, and community services. And there's been a lot of value in having different perspectives. And we've helped each other see what the priorities are, where they fit within our organization and in our own programs and organization as a whole. So that's been great. You can jump to the next slide. And just kind of highlighting the situation that we are looking at now. So we've heard these key points through consultations we did leading up to the development of our strategic plan, and then we clarified or reinforced further as a result of the situational assessments we've undertaken this year to better understand poverty and homelessness across our district. So homelessness, poverty, and food insecurity are persistent and worsening public health challenges that have significant impacts for individuals and communities. People experiencing low income or homelessness face substantial barriers to accessing healthcare and social services, often resulting in increased emergency department use and poorer health outcomes. Despite growing need, responses remain primarily focused on crisis management rather than prevention. So, and public health's role in addressing these issues needs to be more clearly defined sometimes. Finally, one of the key things that we've talked about as well is that those with lived or living experience are rarely engaged meaningfully in shaping the programs intended to support them. And this is a gap that we need to start addressing. And so what is the why of what we're doing? You can jump to the next slide, Shelley. And why are we doing this? So income and housing are highly influential social determinants of health. They shape the conditions in which people are born, grow, live, work, play, and age, and significantly impact health outcomes. Homelessness and poverty are public health issues because they are systemic, widespread, and preventable contributors to poor health. They increase vulnerability of disadvantaged populations on many levels and create barriers to good health. These disparities are systematically linked to social and economic disadvantage. So why are we doing this? Why is this part of a strat plan? I know that social determinants of health, health equity are public health work overall, and public health as a system has addressed these issues for a long time, well before our new strat plan. But what we're doing with our strat plan though now is it was approached often through a fragmented or siloed approach. And the difference now is that we're approaching this as an organizational wide approach, one that is better aligning the work the programs do, learning from each other's successes, and also developing shared approaches to more complex issues and problems.
Yeah, thank you. Okay, next slide. So here's where we're at in the planning process. We've been working to understand what key data indicators that relate to poverty and homelessness, things we should be considering, and what data related to those indicators that we have locally, as well as where there are gaps to inform future data collection projects. We've prioritized developing a clear understanding of where income and housing sit within the Ontario Public Health Standards to wrap our heads around the scope of public health work on these issues. We've been networking with community partners to gain an understanding of what's happening in the community already, understanding their perspectives, what their responses to poverty and homelessness are, and identifying opportunities to collaborate. Lastly, we've prioritized ensuring our group is clear on what our responses to poverty and homelessness are internally. So our group has undertaken a mapping exercise to identify activities the health unit is implementing that fits within this work, and which will help us identify where efforts are concentrated and where there are gaps. So this information has helped us identify the key components of our logic model, and we're making good progress toward planning for meaningful action. Next slide. So here I'm sharing a bit more detail about how we are planning to group our activities. Initially, our group was grappling with the language of our strategy that was limited to just reducing poverty and homelessness. And we were trying to understand how to best fit activities that in theory would align with this goal, but don't necessarily directly reduce poverty and homelessness. So we've arrived at this framework that includes the language of preventing, reducing, and responding to poverty and homelessness to align with the spectrum that we use in public health of upstream, midstream, and downstream approaches to the work. So each area is equally important, but we do want to try to swing the volume of resources being directed to what would be considered responding to poverty and homelessness more toward the prevention side, so that we're focusing more upstream on preventing these issues in the first place. Next slide. And in addition, we want to keep in mind that housing, income, and food are deeply interconnected social determinants of health that influence an individual's ability to live a healthy life. When any one of these is compromised, it can create a ripple effect that worsens health outcomes. Together, they form a foundation for health, and addressing them collectively is essential for public health strategies. We want to break down silos of work happening in these areas to ensure a comprehensive approach, while acknowledging that activities in each of these areas do require distinct interventions as well. Next slide. So in terms of next steps, over the next 6 weeks, we're working on finalizing our action plan for 2026-2027 based on the results of our situational assessment. We're having lots of discussions with the other 3 strategy groups under the health equity priority, given how interconnected our work is. We continue to strengthen partnerships with community organizations. We know we can't do this work alone, and we aren't necessarily leading this work in the community, but we also want to make sure that we're not duplicating efforts, that we're meeting community need, that we're seeking out opportunities to collaborate while staying focused again on that population health approach as much as possible. We want to ensure staff across the health unit understand where their work fits within our strategy to foster a high level of engagement with this work. And in the meantime, we don't want the planning process to stall work that we know can go ahead. So we are moving forward with some activities that we know align with our strategy. And one specific example is that we have expanded our annual work on food affordability to include a more robust housing element. So this reporting will be available in January of 2026, and I'll be back visiting you at that Board of Health meeting with a more comprehensive update on that report. So that's really exciting, and it definitely meets a gap in the community that we haven't filled before. So that's it. We'd be happy to take any questions you may have.
Any questions? Jamie, Larry?
I mean, it's good work. It's just there's so many players in the space.
Yes.
I don't know how you navigate all of these parameters, because there's always talk in the community about being siloed, and then the city has their own committee, and the OHT has a committee, and so how do you go about sorting out the partners, and how do you navigate all that stuff?
Yeah, it's definitely been a challenge. And like you said, there's many, many partners to connect with. And it's been challenging to understand exactly where all the pieces fit and who's doing what. I think the gap that we are definitely filling is kind of being more zoomed out on that population level and working more on the prevention side of things and connecting some of the higher level work that we do to homelessness and poverty prevention. So another really key piece that often gets missed in the community is advocacy and knowledge translation. So often we're sitting on really great data, but we're not doing enough with it. So we really feel that that's a role that we can contribute at the community level.
Yeah, and that's something else we've done as well. We've connected with community partners about data information they've been collecting and making sure that we're getting a really wide picture of this and talking to partners and getting their perspectives as well. And that was part of our situational assessment was, connecting with partners who are doing this work and seeing what they're doing in the community where our work overlaps or complements each other as well. But yeah, you're right. It's
follow up on that. Like, has anybody ever mapped any of this out? Like, looked at each organization and what they provide, and it's almost like leaning out to sort of identify exactly where those things are, and like it's a real mosaic of services that are sort of blobby but to map this out based on organization to clearly identify where these zones are, where the overlap is. I mean, it just seems to me that there's, because of that, nobody's really sat down that I know of to figure out which organization delivers what, and how. So and I don't know if that's part of your assessment or if anybody's ever done that assessment, but to me, that's a key sort of step to figure out where all these players, because there's talk of how different organizations are trying to do their work, but then it benefits another organization with needles, for example. They collect them here and they turn them in here and they get something there's all these, I mean, there may be urban myths or rumors, but I just really don't know. I mean, you have your work cut out for you, because it is just such a hot mess when it comes to all the services, and everybody's got great intentions. It's just, I just see that there's just so much, of unknown to navigate that whole system.
Well, and even what you're getting at is that would be a great suggestion maybe for something to consider in future as a community project. We're doing that internally, and you'd be surprised how much programs do that see within the spectrum of kind of that preventing, reducing, responding. And that visually will help us understand where efforts are concentrated, and even in, it's more evenly balanced, I think, internally for us in terms of that spectrum. But what we can identify at the community level is efforts are definitely, and government funding is definitely more concentrated at that emergency response crisis level, because out of necessity, right? So it's like we need to be drawing more attention to what needs to happen at the prevention level and connecting some of these higher level policy issues with the downstream impacts of what the fallout is if we don't have, for example, strong public policy on housing, income security, food security. Yeah, it's very complex and it's been challenging for sure. And one piece we've worked really hard on is just getting our group on the same page, right? With staff from different programs and trying to get a foundation of knowledge of these key issues and making sure that, collectively we have a good understanding of what's happening in the community, what our role is, and how we need to move forward in a way that feels right based on capacity too.
Thank you very much for your presentation. That's awesome. Next one, priority 3, strategy 2, raise awareness about the needs addressed by the health unit. Kylie Wardell, she is online, I believe. Hi, Kylie.
Hello, greetings everyone. Thank you for allowing me to be part of your agenda for this evening. As you now know, my name is Kylie Wardell. I wear a couple hats on the Health Unit Communications team, currently acting as the Public Relations Specialist, and I am pleased to be a co-lead with support from Alex McDermott and Louise Gagne for Priority 3 Strategy 2, which is raising awareness of the needs addressed by the Health Unit. So from a communications and a research perspective, the title of our strategy on its own is very broad. And so one of the first tasks we were met with was narrowing our scope. We reviewed the summary report, which described the outcomes of the data the health unit had collected from interest holders when they were building the overall strategic plan, and we were challenged trying to define who exactly our target audience needed to be. What we wanted was something that would be manageable within our capacity and also create the most value and impact for the health unit. Next slide, please, Shelley. So it wasn't until we had more context that we were able to see where the greatest need for this awareness was. And some of that context arose from discussions around the board table. We talked with our Executive Director of Community Services and one of our NOW work group members who liaises with municipalities as part of her role, and it became clear that there was room for and an important need for improvement in the way we communicate with municipalities in the Parry Sound and Nipissing districts. For the context of this project and presentation, the term municipalities encompasses staff, management, executive directors, chief administration officers, mayors, reeves, and all elected members of council for municipalities, townships, and villages across the health unit service area. While we recognize the need for the health unit to strengthen communication and relationships with Indigenous communities, we know these communities are already a priority area for other strategic plan work groups and our new Indigenous Engagement and Development Program. As such, the focus of our strategy is the 31 municipalities in our area. Municipalities are an important audience of focus for a number of reasons. First, their constituents, or members of the community, are also the population public health serves. Second, we both have responsibilities to promote and support community well-being and safety, including planning and responding to emergencies. And last, they cost share public health with the Ministry of Health. To inform our work, we will also be tapping into health unit staff, managers, and executive directors who have some form of engagement with municipalities. As direct communicators, we hope that they too will be able to benefit from our strategy implementation. Next slide, please, Shelley. When we think about the work municipalities do for our population, we can see that a great deal of it has a direct link to public health. The Association of Municipalities of Ontario goes so far as to say municipal work is public health. Next slide. In fact, according to the same association, about 90% of municipal operational expenditures contribute directly or indirectly to social determinants of health. Municipalities are a source of co-funding for the health unit. We can start to see how the health unit municipality relationships are a natural fit for this strategy and an important area for strategic prioritization. Next slide. So, to raise municipalities' awareness of the needs that we address, what we are working towards is a communication strategy. Our ideal end state with this communication strategy is that municipalities will see common interests and goals with the health unit, understand how the work we are doing aligns with the needs of their constituents, and can use this understanding to advocate to governments and garner support for public health projects that serve our shared population. In addition, we hope this communication strategy can help to foster mutually beneficial relationships, mutual understanding of operations, and lead to better collaboration to support our populations in times of emergency, crises, or distress. Next slide. So I've talked a little bit already about how we determined our scope and our target population. We took a broad, vague idea and narrowed it down to something meaningful and practical. Since then, we have started working with a consulting group, a Rising Collective, who will be conducting focus groups with municipalities and health unit staff and leaders who communicate with municipalities. Our first internal focus group took place yesterday, and more will be taking place in the first week of December. A Rising Collective will compile, theme, analyze, and summarize the discussions, and use that to create a report that provides an executive summary, an overview of the process, a summary of engagement themes and findings, and recommendations for next steps. What we do and do not obtain from the summary report will inform an in-house environmental scan to understand our current communication patterns with municipalities, and a literature review to understand best practices. With a strong data collection plan in place to assess our needs, we will be able to establish our SMART objectives and make recommendations that will help us achieve our desired outcomes and outputs. We anticipate having a draft communication strategy in place for spring 2026. It will be presented to our target audience for their feedback before we proceed to the planning and implementation stages. Next slide. That concludes my presentation. I will now open the floor to questions.
I got one, right?
Okay, thank you, Kylie. Tim?
Just a question. We have in our area of responsibility, we have multiple unorganized townships. Have they fallen through the cracks, or how do you deal with an unorganized township that has no municipal group per se? And generally, the unorganized township also have covered some of the mandate of food insecurity, poverty, because they're isolated individuals that are living out in the bush. And I'm just wondering, has that been taken into account? Because there are multiple.
Louise, do you care to speak to that?
That's a great question, Tim. At this point in time, they haven't been included in this assessment. But that's not to say that we can't include them as we move along into the strategy. The timing of which we're doing the focus groups is pretty short. And as it is, we're starting to see some people that are not available in December. So it's certainly something that we can look at how we can better reach them in the new year.
I understand based on pure population, you want to hit the larger population groups. I totally get that. But like I said, I know there's multiple unorganized townships that could probably really use the help that you guys are targeting as food insecurity, homeless, housing, all that kind of stuff. I just wanted to toss it out there.
Oh, I appreciate you bringing that forward.
Identify that.
Well, it's great work too. And we've talked about this before, about getting out there to the public and letting them know exactly what the health unit is doing. And this is the one way of doing it, and especially with the municipalities, getting them involved. This is absolutely awesome. I think it's great. Any other questions? No. Online? Again, thank you very much. This has been a great presentation, and thank you so much.
Thank you.
Thank you, everyone.
Thank you.
Thank you. Thank you, Chris.
Okay, please.
All right, 5.0, approval of the previous minutes. Need a mover and a seconder, please.
I'll move it.
Tim? Seconder? Karen? It be resolved, the minutes from the Board of Health meeting held on September 24th, 2025 be approved as presented. Rick Champagne, yes. Karen Cook?
Yes.
Blair?
Yes.
Jamie Larry?
Yes.
Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Tim Shepard?
Yes.
Marianne Stickland?
Yes.
Dave Wolf? Carried. Next item is 5.2, Board of Health in-camera minutes on September 24th, 25. Need a mover and a seconder. Dave Wolf. Jamie Restool. It be resolved that the in-camera minutes from the Board of Health meeting held on September 24th, 2025 be approved as presented. Rick Champagne, yes. Karen Cook?
Yes.
Blair Flower?
Yes.
Jamie Larry?
Yes.
Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Tim Shepard?
Yes.
Marianne Stickland? And
Yes.
Dave Wolf?
Yes.
Carried. To new business arising? Nothing. Report of the medical officer, Dr. Zimbalati. Floor is yours.
So the report is in your agenda package, and I'm happy to take questions.
Any questions for Dr. Zimbalati? That's awesome.
Happens to the outdated vaccine fridges. And are the new ones Canadian built?
I don't believe the new ones are Canadian built. We did try and source, but we're unable to. I can double check on that.
Did we buy American?
I believe so. Unfortunately.
Okay, are there no Canadian providers of these units?
I'll have to double check.
I'd really like to know
We
if there's
did
no
have that.
Canadian suppliers of these units. That would really be beneficial for me to know that.
Very specialized, but
Yeah.
we'll check for that.
Yeah, if that could come back at the next meeting, I'd like to know if those were purchased Canadian or not.
It is something we specifically discussed at AT is,
Okay.
anyway, yeah.
I'd like it in the minutes. I'd like to know that those were and why they weren't purchased Canadian if they're not, so that we have something to speak about with our friends at both levels of government.
Voted?
Excuse me, I think that might have been my own question, but no, it's not. So we're promoting vaccines in schools, grade 7 vaccine program. So on page 9 of 13 is where I'm at the top of page 9. Doctor. We're promoting vaccine usage or acceptance. Do we actually vaccinate the kids?
Yes.
And what are we doing in the schools to do that? Like, do we get parental approval? We talked about this at the last meeting, I think, too, did we not? We've changed the way that we're getting approvals to be able to vaccinate.
It is generally for school vaccinations, it is through the child who is attending.
Okay. So that reminds me, things that were.
Still looking through, Dave. Jamie's got a question.
Mine was, I might just, so we used to do, the health unit used to provide someone to go to like a seniors complex to do vaccines and flu shots. My understanding is that they don't do that anymore. We direct them to clinics, like public clinics. Can you explain why they changed that?
So I think the capacity is there for some individuals. There are also partners who can assist with that. In terms of the budget that we're able to have and the staff that we have, it's not something that can always be accommodated.
So for follow-up, so if we had an organization that could hire a nurse, would the health unit supply the vaccine?
Well, we definitely would, yes.
We could arrange our own clinic, for example. Place could organize. The only reason I asked that is because it was something that was so beneficial, because it's hard for some of these seniors to get out to these clinics, right? So and what used to happen is the health used to come in and they do 270 or 250 seniors right there. And so, now we were told that they would, in these 2 or 3 that I'm involved in, that they can only go to clinics now, and they're just finding it more difficult to get that done. And I'd say it's worth the investment because it potentially can save the emergency department, right? With visits and stuff. We can get more people done more effectively than trying to get them to go out to do this. So maybe we'll talk offline about it. I just thought there was some new, legislation or directive or something, but that they weren't supplying that anymore. Because what I had heard also that there wasn't enough vaccine. Like, I find it hard to believe, but.
We're only given so much vaccine through the Universal Influenza Immunization Program, and we are responsible for allocating that to all providers in the area. So we can't necessarily fulfill all orders 100%, depending on timing of things and depending on what orders we're seeing coming in.
Okay, so how is that? Like, is there a criteria? Like, would you do vulnerable groups first, or like how would you decide on on that?
So we offer our clinics through the community
Yeah.
clinics that we and then also in-house. And we do have partnerships with community paramedicine as well to provide vaccine to homebound individuals.
Because I think that's how they used to do it. Actually, now come to think of it, used to be the community paramedic came in and gave everybody their shot in these seniors things.
So we still have partnership agreements in
Okay.
place with community
All right,
paramedics.
lots of gets more detail on it. It was just a switch from what I understood in the like O&R building and some other buildings where they were the health unit was actually conducting or supplying or doing something.
I mean, it was different during COVID times,
Okay.
right, when we had more staff available. Yeah, it was a different time. Pre-pandemic, we were not doing that work.
Okay, no, I just thought it was a great, effective way to get concentrated people that are vulnerable to just get them to get it done and just saves the system. So, thank you.
Also, a lot of them also have a healthcare provider, so we do, advise as much as possible that people receive their care from their primary care provider.
Back to you, Dave.
Yeah, I thought it was interesting, the vaping program with the Near North District School Board.
Mhm.
I thought it was interesting. We didn't name the high school. I'm wondering why we didn't name the high school. Because I'd like to know if there was success in that particular institution, which it sounds like there may have been. And if we're expanding that to look at other boards of education, and what the result is in terms of whether or not some of these kids have just gone back to vaping again, and how we monitor that.
Yeah, so I don't have answers for you in terms of how we would even, I don't think we would have the information initiative to know if there was a change before and after, and then, 6 months later, again. Yeah, I don't think we can collect that amount of data. There's a lot of surveys that happen in schools. There's the school climate surveys, there's the OSDIS survey, there's the survey through youth, and I think I'm missing another one too. So to do even more, there's some element of survey fatigue.
Is there a way to engage student councils though at high schools to do something observational? Obviously, kids go to a designated area to vape. That's what I'm seeing here. That's what we see in schools. Is there a way that we can, we do head counts on all sorts of things. Is there a way that they know their peers? They'd be able to say, well, there's, on any given day, there's 25 or 30 kids out there vaping. Now there's 40 kids out there vaping. So we've done a program, but are we making an impact is what I'm getting at.
Yeah, I'm not sure if that kind of data is truly informative, representative. There can be shifts in the patterns. What we do when we're working with students is it's a lot of the initiatives are led by them, guided by health unit staff. So it's something that they can take ownership of and respond to themselves. So it can be highly individual what happens in a given board or in a given school.
Okay. My last question is on the PFAS. Did I read that there's a class action suit that's been filed or is considered to be filed, has been filed? Thank you. Are we named? Is the health unit named as in the class action suit? Thank you. Go ahead.
Any other questions for Dr. Zimbalati online? I see none. Thank you for your report, Dr. Zimbalati. We'll move on to correspondence. You look at it whenever you want.
No, work.
Oh, what's that?
It can be reports.
Okay. Oh, sorry. 8.1 Personnel Policy Labor Employee Relation Committee. Need a mover and a seconder. Jamie, Larry. Second by Blair Flower. Whereas the Board of Health conducted a performance evaluation of the Medical Officer of Health Executive Officer in 2024 as required by bylaw section 4 and 54. Whereas the Board of Health approved that the next evaluation occur in 2025 and continued the ad hoc Medical Officer of Health Performance Evaluation Committee for this purpose. And whereas the competing organizational priorities are limited to capacity, have made it infeasible to complete this evaluation in 2025. Therefore, is it resolved that the recommendation of the Personnel Policy Labor Employee Relation Committee that the Board of Health of North Bay Parry Sound District Health Unit approve deferring the 25 evaluation Medical Officer of Health Executive Officer to the first quarter of 2026, and be further resolved that the remuneration of the Medical Officer of Health Performance Evaluation Committee members can continue in accordance with the Board of Health Section 479. Any discussion on this motion? Okay. Rick Champagne, yes. Karen Cook?
Yes.
Blair Flower?
Yes.
Jamie Lowry? Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Tim Shepard?
Yes.
Marianne Sticklin?
Yes.
Dave Wolf? Carried. Okay. Second part, 8.1. Now mover and a seconder, please. Dave Wolf. Keep putting up your hand there, Jamie, but I'm gonna go to Jamie McGarvey.
Rasul had his hand up.
I got him the last time. Whereas the collective agreement with the Ontario Nurses Association and the Ontario Public Service Employee Union, as well as the management non-union employment policy, expires on March 31st, 2025. And whereas the negotiation were undertaken with the Ontario Nurses Association and the Ontario Public Service Employee Union, and both unions ratified their respective agreements in November 2025. And whereas the negotiations for the management and non-union employment policy include monetary adjustments identical to those negotiated with the Ontario Nurses Association and the Ontario Public Service Employee Union. To be resolved that the recommendation of the Personnel Policy Labor Employee Relation Committee that the Board of Health approve the changes to the collective agreement between the North Bay Parry Sound District Health Unit and the Ontario Nurses, the Ontario and Association and Ontario Public Service Employees Union, and approve the revised management non-union employment policy for full-time, part-time employees, effective April 1st, 2025 to March 31st, 2027. Any discussions on the motion? Rick Champagne, yes. Karen Cook?
Yes.
Blair Flower?
Yes.
Jamie Laurie?
Yes.
Jamie McGarvey?
Yes.
Jamie Restool?
Yes.
Tim Shepard?
Yes.
Marianne Sticklin?
Yes.
Dave Wolf? Carried. Thank you, Paul, for the work you've done on this. And I know it's a long haul, but thank you very much. Move on to 10, new business. Okay, well, correspondence. Okay, there's nothing there. You want to read it? There's packages, right?
It's available for.
Yeah. Nobody's got anything to talk about. Nobody's bringing anything up. Perfect. New business, Association of Local Public Health Agency Alpha 2025 Fall Symposium Summary report from Dr. Zimbalati.
It's in the package.
It's in the package, yes. Just a note to it, whenever we decide we want to go on these symposiums or we want to go to the Alpha conference, let's just make sure that we do go. It's a little costly when you don't show up and don't go to it. So let's just make sure if you decide you want to go to it, at least make sure you're going or get somebody else to replace you. Okay. Any thing you want to talk about on the package?
Just want to, I think there's a lot in there, so thank you for that. For me, the most significant part of this is under the legally speaking section.
Mm-hmm.
I think we should all be aware of what our role is and what that mandated to do, what we're not mandated to do. So just if anybody didn't read it, that section's pretty good.
I like that stuff, Dave.
Well, it's important. It speaks to governance and it allows us to understand where we need to step in and where we are allowed to step in and where we're overstepping. Right. And I just think that sometimes, and we're all guilty, I'm guilty, probably more than others, but sometimes we engage in areas where the people around this table, it's not necessarily in our purview to be doing so. So just cautionary tale.
Thanks. Yeah, it was a very good session.
Me?
Goes in, figures out.
Dr. Zimbalati? Any other questions for Dr. Zimbalati? Okay, thank you. Next one is third quarter financial statements. Any discussion?
Just wanted to add something for Dave on this.
Okay.
The overall trending is under budget. And for the year with no forecasted concerns. Remember last meeting?
Yes, I always ask that. Yeah.
I was trying to get ahead of it.
I noticed we're under budget significantly in a couple of areas, but
Yeah.
it's not the time to go into that until we're going to have a budget discussion. So I just made notes and I noticed that we're under budget in a couple of areas and I will have questions sort of why. I think you probably know where those are anyway. So I would just say when at the appropriate juncture, if you want to get ahead of the hurdle, you can speak to those areas, in a preamble would probably be a good place to do so.
I was ready to do that.
Perfect.
So there was any major variances would be a program service reorganizations that we did this year. So certain people were allocated to one and then moved to the other. So there's funding alignments for that. There's vacancies, which is a major contributor, and negotiated increases weren't in here yet, right?
Yeah.
Just agree to that. So those are the major variances. A lot of that will be corrected when we get to the fourth quarter and we're creating our 2006 budget.
Yeah, and we anticipate seeing that in January.
The budget will be in January, the 28th meeting.
Okay. Yeah.
We had to move it this year because we just finalized the negotiation and obviously costs are a major component.
No, and I 100% agree with that. I mean, we had that discussion. I think it's important. It's wholly appropriate to make sure that the numbers we go forward with are reflective of the reality, not the anticipation. Not the least of which reason is because we have to be accountable to some extent to our municipalities when we are seeking additional funding. And I don't want to prejudice the process, so I won't go any further. But it's just, I think, very beneficial to be 100% assured that the numbers that we're talking about are the numbers that we actually can justify.
Yeah, we'll go through that in January when we do the budget. So
yeah, exactly. That's why I appreciated the numbers for tonight. It's helpful. I just noticed we are under budget in a number of places. We're over in a few areas too, but it's normal. But I appreciated having the numbers for tonight's meeting because I knew that we weren't really going to see anything substantive until January. So I appreciate that.
thank you, Dave.
Certainly in January, when we bring the budget for any major variances, you don't wait for questions to come in on them, right? They're notated and there's a reason, but no provided as to why. But obviously, we strongly encourage questions from the board, especially in advance on that, so that we can provide the answers in advance to everyone, just in case they have follow-up questions.
Sure.
Can I just add to that too, because of the operational detail and the complexities with our budgets, you see the major piece. Anything in advance will be helpful in moving that through.
Okay. Everybody hear that online also? Any questions for budget time? See if we can get them in on. Okay. Jamie, did you have something or just thumbs up?
Nope, I just wanted to get my hand up for the next resolution so you can shoot me down again. Just kidding. No question.
All right.
No surprises for us, no surprises for you. Is that okay?
All All right, we'll move on to 10.3, third quarter medical officer health expenses, July 1st to September 30th, 2025. Look at them, no issues, okay. 10.4, third quarter Board of Health expenses, July 1st to September 3rd, 2025. Any discussions on this? I see none. Move on to 10.5. Need a mover and a seconder, please. Jamie Restool. Need a seconder, Jamie Restool. Karen Cook. So whereas the all staff holiday celebration luncheon will take place on December 10th, 2025 from 12 noon to 1 p.m. at the Best Western Hotel and Conference Center, 700 Lakeshore Drive, North Bay, that it be resolved that the Board of Health for the North Bay Parry Sound District Health Unit authorize the Board of Health members to attend the health unit's all staff holiday celebration luncheon on Wednesday, December 10th, 2025. And furthermore, to be resolved that the Board of Health approve the Board of Health members' expense related to the attending this holiday season celebration luncheon in accordance with the Board of Health bylaw section 6, 79 remuneration. Let's just let Ashley know who's going to be attending, who's not going to be attending, and I like Stones were there last year. It was pretty good. Hopefully they have the entertainment again that they did last year. So be nice to see.
No.
You don't know? It'll be a surprise. All right. Any discussions on this motion? No? Okay. Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Jimmy Lowry.
Yeah.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Tim Shepard.
Yes.
Marianne Sticklin.
Yes.
Dave Wolf. Carried. So the next one is 10.6. Association of Local Municipality of Health Alpha 2026 Annual General Meeting Conference motion, notice of motion. Like every year is the question asked, if anybody wants to attend. The reason they're doing it right now is because they have the FIFA soccer tournament coming up, so need to book rooms well in advance in order to this happens in June. Again, if anybody wants to go to it, I think we put up to 2 board members usually we put up.
I think it's up to 3.
It's a 3. So we can approve 3 of them, and then we'll go from there. And whoever wants to let Ashley know, or Dr. Zimbalati, and put your name forward. Fair enough. So moved by Jamie Restool.
Yeah.
Second.
Stephen McGarvey.
Well, hang on a sec. We haven't heard from Marianne Sticklin.
It's okay. I can do the adjournment.
There's no.
There's no adjournment. I just put you down for a seconder. So moved by Jamie Restool, second by Marianne Sticklin. Be resolved that the Board of Health of North Bay Parry Sound District Health will authorize 3 Board of Health members to attend Association of Local Public Health Agency, Alpha, 2026 Annual General Meeting and Conference to be held June 8th to the 10th, 2026 at the Radisson Blue downtown, located at 249 Queensway in Toronto, Ontario. Furthermore, it resolved that the expense related to attendance Alpha Conference, General Meeting and Conference be paid in accordance with the Board of Health bylaw. And be it furthermore that the attending board members be required to provide a summary of the symposium of the the Board of Health in subsequent meeting. Any discussion on the motion? Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Jamie Lowry. Yep. Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Tim Shepard.
Yes.
Marianne Sticklin.
Yes.
Dave Wolf.
Yes.
Carried. Next meeting, January 10.7. Oh yeah, schedule. There's a schedule there for all the meetings.
Cancel December and
Okay.
January. Time and Tuesday. Yeah.
Okay. Everybody's noted that for the time changes. Okay. web and camera.
There's a motion for the agenda.
Oh, there is?
Sorry, the schedule.
Let's skip. Oh, I did too. Sorry about that. All right. Need a mover and a seconder. Karen Cook. Second by Mary Ann Stickland.
Yes.
Whereas the accordance of the Board of Health bylaw section 3-51, the Board of Health approved the regular meeting schedule for the 25 to January 22, 25 Board of Meetings, and whereas a revision of the previously approved Board of Health meeting schedule were required as follow. Date change, do I have to read them all? Or are you all good? February 26, 23, December 3rd was changed, and January 28th is the new one. Changed 5 to 8 p.m. Correct? Any other discussion? Okay. Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Jimmy Larry. Jimmy McGarvey.
Yes.
Jamie Restool.
Yes.
Tim Shepard.
Yes.
Mary Ann Stickland. Dave Wolf.
Yes.
Date of the next meeting is January 28th, 2026, time 5 p.m. to 8 p.m. Place right here. Right, in camera. Need a mover and a seconder. Dave Wolf. Tim Shepard.
Yep.
It resolved that the Board of Health move into camera at 6:43 to discuss agenda items 12.2, a trade secret or scientific, technical, commercial, financial, or labor relation information supplied to the in confidence to the board, in which is disclosed could reasonably be expected to be prejudiced significantly the competitive position and therefore significantly with the contractual or other negotiations of persons, group or persons or organization. Rick Champagne, yes. Karen Cook.
Yes.
Blair Flower.
Yes.
Jamie Larry.
Yep.
Jamie McGarvey.
Yes.
Jamie Restool.
Yes.
Tim Shepard.
Yes.
Mary Ann Stickland.
Yes.
Dave Wolf.
Yes.
Carried.
you.